So it's high time to discuss the important topics for the paper 2, as I've already uploaded the important topics for paper 1. You can check it in my description. Now let's start with the important topics of paper 2. Before starting, I have a good news for all you all, that you know what pattern I used to follow for the important topics. I used to just show the topics on the screen and you have to write down on the piece of paper, and it's a troublesome for many of the candidates. So they all requested me to either share the PDF on the Telegram group or do something so that the time, so it can be a time saver for you all and you get the material in a better way. So I am coming up with an ebook which I have already uploaded on the Amazon, and it would be available for you all within 1 to 2 days. As you can see on my screen, there's a kdbamazon.com in which my book name is going to be Important Topics for UPSC CMS 2023. As you all can see here, this is going to be the cover page. So this is going to be the important topics for UPSC CMS 2023, and the good news for you all is that it would be including the important topics for both paper 1 and paper 2. So if the lucky ones who have not yet noted down the important topics for the paper 1, so they can get the both in the download. They can have both paper 1 and a paper 2. And in this I want to clear it. Know that in the previous video of the paper 1, I have divided the topics into 3 parts: guaranteed, VIP and important. Guaranteed means कि topic आना ही आना है. If you do a single topic wrong of the guaranteed topic, then forget your selection. I guarantee your selection would not be done if you do a mistake in these guaranteed topics. So you don't have to miss on these guaranteed topics. It should be on your tips. Then the next come is the VIP topics. So this is out of 4 questions, 3 would be asked. So it's not guaranteed, but it's not also something which you can miss out. But the order of your reading would be, you would first do the guaranteed, then you are going to do the VIP topics, and then you are going to do the important topics. But you don't have to miss any of them. And for the paper 2, I have approached the different pattern. Instead of guaranteed VIP, I have given VIP, recent 2 year and the important. And the reason behind this is, like in the paper 1, only 2 subjects are asked, medicine and pediatrics. So there is a chances then they are going to repeat the topics frequently, as the subject is only single like medicine. कहाँ से वो इतने नए questions बनाएंगे? They have to repeat the topics. So there is a list called guaranteed. But in the case of paper 2, you have surgery, obs gynae and PSM. They themselves are a very vast subject. So they have a chance and they have the multiple options to ask you the different questions. So for that, the safe zone is VIP topics and recent 2 year topics. In that, VIP means out of these like 4 topics, 3 would be definitely asked. But there is not something like guaranteed that this topic is asked every year. ऐसा नहीं है, but it is very high yield. And the next comes recent 2 years topic कि recently 2 years में क्या trending है. Like हर बार जो recently जो examiner के mind में चल रहा होता है, they used to repeat that. वो आपसे 2002 के question नहीं पूछेंगे. They are not going to ask you the previous 10 year questions. They are just going to revolve around the recent 5 years, and in that too they are going to revolve around the recent 1 to 2 years. What trending topics for them are. So there are VIP, recent 2 years, and the last come the important topics which are asked, but they are not asked every year. But I have compiled all of the topic in just these 3 lists. So if you are able to do these 3 lists of the paper 1, these topics, and paper 2, definitely your selection would be there. Now you would be assuming like, ma'am, instead of doing these topics, we should go for a guidebook and do whatever recently last 5 years they have asked. Just remember one thing, UPSC के जो क्वेश्चन के जो पैटर्न्स होते हैं, इट इज़ नॉट लाइक के दिस इज सीन इन ऑल एक्सेप्ट, ये सिंपल टाइप के नहीं होते. दे हैव द ABC out of 4 options like statements ABC are correct or ABD are correct. So for that you have to know the topic in depth. So no matters you do those topics from your coaching notes or from the standard books, it's up to you, but you have to prepare the topics, not the questions. So अगर आपको कोई टॉपिक है, if you're not able to find in your coaching notes, then the first source to find that topic should be your textbook. Okay, So my ebook would be like in the pattern as I have already said. The content one would be guaranteed topics. So guaranteed topics I have divided in the subject wise, like general medicine, in that I have questions like suppose diabetes. Every year 3 questions are asked, either from the mellitus, insipidus, gestation, risk factors. It can form in either form, it revolve around these forms only. So 3 questions are guaranteed. Like same for the insulin, 1 question is guaranteed on the classification of insulin. So the guaranteed topics would be like this, and VIP topics also I have divided according to the subject wise. You will find the list subject wise. Then for the paper 2, if I talk about, I have put on the weightage, what weightage of the questions are. Like from surgery 40 questions are asked. So surgery I have divided VIP topics, like the VIP topic is breast. In breast they can ask you about the breast cancer, about the Paget disease, Mondor, lymphedema, breast abscess, about the MRM. So I have included the topic and what questions are asked from those, all the relevant questions I have put on. Then if I talk about recent 2 years, then these are the recent 2 years trending topics for the PSM. So the doubt is मैम अगर हम इसको read करते हैं, like the book whichever you are uploading on the ebook, इसको अगर हम read करते हैं तो can we skip these? Yes, you can skip these because these are the papers which was uploaded in 2021. These were the important topics at the time when you was appearing for the 2021. 2023 is going on. Prepare according to the 2023. So there are many lot of questions which are not there in these videos. So yes, you can skip these videos. And what about the video you have uploaded, this one? If anyone who is not interested in the ebook can read those topics from this video, in which I have done not a single change for the list of paper 1. So if you have done from the paper 1 from this list, then you don't have to see that ebook paper 1 part again, you just have to see the paper 2. So I think it is going to be beneficial for you all. So stay tuned and please study hard. Only around 2 months are left for your exam. So if you have any doubt, you can ask me on my Instagram ID which I have shared on the screen. So all the best, keep studying. Good.